so much. My name is Dr. Matt DiDuro, and I'm the Chief Medical Officer for SoftWave Tissue Regeneration Technologies. I know I see you guys kind of finding some seats and working in. As we're waiting, I'll just kind of tell my quick story. I've been in healthcare for 28 years as a chiropractor, and back about 15 years ago, I had a 350-pound patient fall off the table. I grabbed him, dislocated my right shoulder, tore ligaments in my wrist, and basically ended my practicing career. I had 2 surgeries, one to correct my detached labrum, and then one for my wrist, torn ligaments, and I was 90% better with my shoulder, but I was left in constant pain after my hand surgery for nearly a decade. And I was lucky enough that I got to run into our CEO and founder, John Warlick, who invited me up for a treatment. And I literally did 3 treatments over 10 days, and I was 95% better. I purchased a device for my clinic in Atlanta that deals mostly with chemo and diabetic neuropathy patients, and I didn't have to treat my wrist for another 14 months. Did you hear that? So it was like 3 treatments and I was 95% better. So, I went to John and said, hey, I can help place this in every major city in America, and he laughed at me, and this is 5 years ago, and we're now approaching 600 centers that have our technology in, so it's been a really fun ride. I fell into this, but I also fell in love with it. So this is titled, When Nothing Else Works. And this is different than any other shockwaves per se. This is genuine lithotripsy. So the same technology they use to break up kidney stones, this is really a 3rd generation. It's a smaller version. You don't need anesthetics, but we're finding that it has some really positive biological effects, basically wherever you place it on the human body. This is Dr. Martin O'Malley. He's a foot and ankle specialist in the NBA, and he has a little recording for everyone.
Good afternoon, my name is Dr. Martin O'Malley. I'm an orthopedic surgeon. I practice at the Hospital for Special Surgery in New York, and also I'm a team physician for the Brooklyn Nets, New York Giants, and for USA Basketball. We'll spend a few minutes talking about our experience with the SoftWave technology from TRT Technologies. We first purchased our machine back in 2014, so we've had them for about 8 years. We started with one because the demand became so great, we had to purchase a second one, and we're quite happy with our results. I practice with 2 other orthopedic surgeons. We are all team doctors for different professional teams, and this is our office, and I'll show you our machines. So we go down to our office, and this is the most common thing that we use on a daily basis for non-operative care. It is the SoftWave technology. The machine is pretty compact. It's easy to use. We can dial up the power on it and the millijoules. It's the medical assistants or the PAs are the ones who actually perform the SoftWave. We indicate the patients. They come back off the room and operate with patients who have a whole list of shockwaves. We have shockwaves today, we have 5 shockwaves or 6 shockwaves. Pretty easy to use. Foot pedal. And you can dial the intensity to whatever medication you have. We've had great experiences. We see a lot of plantar fasciitis, a lot of Achilles tendonitis. That's our 2 main indications for it. But any of the tendinopathy, it's very effective for. Also, because we have foot and ankle, we have some diabetic patients with diabetic wounds, and actually it's approved by the FDA for diabetic wounds. We have some really remarkable studies for wound healing. You have to put a sterile cover over it, but in order to recruit stem cells and form new stem cells, the TRT technology is really good. The biggest advantage is really the SoftWave technology. Because it's SoftWave, it's a more diffuse wave, patients can do it without anesthesia. Even though there's a CPT code for insurance, doesn't reimburse for it, but we have no problem getting the patients to pay for it. The patients are very willing to pay to get better, and especially for technology that works. We published a study back in think it was 2020, the Journal for Ankle Surgery, using SoftWave unfocused technology, medium intensity for plantar fasciitis, and we had 85% success rate. So we're very happy with it. It's really part of our daily practice here at Sports Foot and Ankle. And I'm not sure how you can practice in 2022 as a sports medicine physician without using some sort of shockwave technology. It has a tremendous number of randomized control studies showing the technology works. And compared to the other devices, I think the TRT device is the most user-friendly and the most effective.
Again, that's Dr. Martin O'Malley, foot and ankle specialist for 4 different NBA teams, the NFL, U.S. Basketball Association as well. So, I mean, if you heard his last comment, it was like, if you're doing sports medicine in 2022, you have to have some type of SoftWave technology in your practice, in your repertoire. And we're seeing that it speeds healing and accelerates it. I'm going to go over a couple studies, but shock waves are they're in nature. We've seen them in lightning bolt and thunders, also the supersonic jets with Top Gun right now. It's so big, right? So this is wild. This is like taking a thunderbolt and lightning and putting it into a handheld applicator that we can place on the human body and helps reduce inflammation, as well as activates the body's own natural stem cells within minutes of treatment. So this is low intensity. Again, you don't need anesthetics, and it can penetrate the depth of a soup can into your body. So it's unfocused, so the whole bottom of that soup can is also the treatment zone. And what makes ours different than any other radial pressure wave is what you'll see is that high pressure, low pressure. So it's that clap of thunder, and that creates a shearing force that I'm going to show you in just a minute. But this is really important for the biological effects. This is from the international guidelines on shockwave, and as you can see, there are ours is in the red. The bluish purple one is really for a diagnostic ultrasound, so it just goes up and down, and then you can see the radial is the black one. So there's nothing, that's our fingerprint, that red one. And there's nothing else on the planet that does this type of impulse. So specifically what's happening is called mechanotransduction. And mechanotransduction is important to understand. And you can see during that 3 to 4 microseconds what's happening on a cellular. So first you have the cell membrane is compressed by 2%, and then it's expanded by 10%. And that creates this shearing force that knocks a lot of those oxidative agents off that cell membrane. And it improves cell membrane permeability almost immediately. And what also is happening through the shearing force, these sound waves that are traveling 3,355 miles an hour, that they also will shed microvesicles. And these are like messenger RNAs and exosomes, and they're the precursors to the stem cells. So specifically, the research is showing that it's activating our innate immune system, specifically toll-like receptor 3. And there's a term you're going to start hearing more often called mechanoinflammation. And this is where we're seeing that toll-like receptor 3 is so important in modulating inflammation. And let's face it, I mean, we heard it, inflammation is really the true silent killer. And it's part of every disease process and aging process. So if you can find something that can modulate inflammation, that's the golden bullet. That's the silver bullet right there. So that shows mechanotransduction. This just talks about the physical, chemical, and biological effects. And really it talks about this helps improve circulation, angiogenesis.
TOBi was new.
I'm Italian, I need my hands anyways, this will be good. Thank you. So, it helps decrease inflammation, stops apoptosis, and decrease in cellular death tissue, necrosis. And that's kind of what you want to look for. Very excited. Now on board is Dr. Wolfgang Schaden. Dr. Schaden is an amazing hand surgeon, world-renowned, and he is now part of our international medical director for SoftWave, and he's really the OG of research. And he was given this device probably 20 years ago to prove that it was a sham. Because in Austria, they might have the best healthcare system in the world. If you're injured in Austria, you can go anywhere else if they don't offer that treatment in Austria. So what was happening for a lot of non-healing fractures, they had patients that were going down into Germany, you know, having to pay for transportation, having to pay for room, overnight stay, and then the procedure. So Dr. Schaden's director at the time got a loaner, and he gave it to Wolfgang and said, Wolfgang, your job is to prove that this is a sham. So he had 90 days. After 45 days, he went to his director and he says, I'm not going to work without this device anymore. So they used it on anything that wasn't getting better, which was like non-healing fractures, open wounds. And many of our patents were partnered with Dr. Schaden and our CEO, John Warlick. So this is a little message from Dr. Schaden.
Our idea was the following. When we use the big device for bone treatment, what we concluded is the following. When you apply a shockwave, you see that you focus on the bone in the depth of the tissue, and the skin is hit by the default part. So the very first step in treating skin was to develop the therapy head is not anymore an ellipsoid, but a parabol. When you use a parabolic reflector, depending where you put your part, you can shape your shockwave. And this is how we first invented the defocus shockwave, because we wanted to treat big areas where we have skin defects. And this is the way. This is now such a parabolic reflector. Instead of having an ellipsoid with a focus device, because in those days the industry only offered focus devices because this came from urology, and they always wanted to focus the energy just on the stone and not on the surrounding tissue. And so now we had a complete different approach to this technology, because we knew the focal area is perhaps not really of interest when we are treating soft tissue. So we started, and now we can say wherever therapy touches the screen, and we have ultrasound gel as a coupling medium, shockwaves are delivered to the tissue, and another advantage, it's less painful, because the energy is not concentrated on a small area.
So it was like he was right here, Dr. Schaden. So this is the therapeutic effects of SoftWave. It helps with pain relief. Amazing, we see a 50% reduction in pain within 3 visits. It helps modulate that inflammatory factor. And I really think this is the culprit where most of the pain, especially these chronic pain patients, because, and people say, well, why is that? I said, because when I put my device on pain, it goes away within minutes, and it's like a near immediate response. We've been here for the last couple of days. I hope you had a chance to experience it for yourself. but also endogenous growth factors, so VEGF, vascular endothelial growth factor. Even in cardiology, they're loving it because of it stimulates the progenitor cells within our interarterial plumbing system. So it helps with osteogenesis, and Dr. Schaden estimated just in the workers' comp over the last 10 years, it saved 70 million euros in non-healing fractures. Activation of mesenchymal stem cells, as well as tissue remodeling and regeneration. The really beautiful thing is our patented technology of that unfocused probe with a parabolic reflector. And the nice thing is we have this flexible diaphragm, so you can really aim and point and get it right to the tissue, to the epidermis. This is what that true SoftWave looks like. And again, the depth of penetration, and you can see where the red is really targeting on the treatment. And the really cool thing about this is there's a diagnostic component. What do you mean? Well, when you run this over normal tissue, there's no pain. But as soon as you get to an area of poor circulation, inflammation, arthritis, there's this biofeedback component because of the mechanotransduction, where the patient will say, right there. So you can pinpoint exactly where that pain is. So there's a lot of confusion in the marketplace. I think, there's a lot of people that just want to put all shock waves into one basket, and that's not the case. Again, there are beautiful conditions that these other devices will use. We tend to focus on some tough cases. Again, it's low intensity, treats musculoskeletal issues, burns, wounds, ED, Peyronie's disease, and persistent genitalial arousal disorder. Again, the blue tip is mostly used in non-healing fractures and also urology, and the yellow one is the unfocused, and that's what most of our orthopedics, chiropractors, physical therapists, osteopaths use. This is, we're really excited as of January 1st, 2022, Medicare is now reimbursing, so we have codes for the wounds and ulcers and burns. So again, it helps reduce pain reduction, and helps improve blood supply by 300% within minutes of the treatment. These are some examples. First one is obviously a bad foot ulcer that was non-healing, and this is over a 6-week period. It was once a week for 6 weeks, and that's what you see at the end result. And the good thing is, healing takes time, but there's an endpoint in healing, and this is proof. The slides on the left is of a talus, of an ankle, a non-healing talus fracture, and this was 4 visits over 7 weeks, and you can see on the right picture it's been fixed. It's proven technology. There's been over 3,000 studies in the shockwave marketplace over the last 30 years. 1,000 of them have been performed in the United States, which is wonderful. And we have over 133 peer-reviewed studies on this device. Comprehensive cellular regenerative medicine options. This is regenerative options for the blue-collar worker, because most patients only need a handful of treatments, and these are very affordable. So most treatments can be, the whole package could be under $1,000. This is the future, and as you can see, it's basically wherever we place this on the human body, there's some positive biological effects. And even the spinal cord injury study going on in Austria right now for the last 2.5 years, pretty cool. It basically made a national health mandate that any spinal cord injuries have this treatment done within 3 days. There's this window that they want to get to before the scar tissue. And in the last 2.5 years, they've had a 50% reduction in spinal paralysis when compared to the previous 18 years. Did you hear that? That should make everybody spill their coffee and, what? 50% reduction in spinal cord paralysis. Application areas for overview. Again, it works wonderful with any type of musculoskeletal and pain conditions. Trusted, and one of the leading. We're in UC California, San Francisco, San Diego, Baylor University, Cleveland Clinic, Mayo Clinic. We're at the UFC right now. 3 different NFL teams, including the Miami Dolphins right down the street, and Pittsburgh Steelers. Effective, proven, and convenient. 51 pounds, it's mobile, and I truly believe that over the next couple of years, there's going to be 2 types of clinics. Those who have SoftWave and those who don't. And I believe that you're going to start hearing and reading more about this technology, and hopefully you'll remember SoftWave tissue regeneration. Thank you. You can scan this. Please visit us over at the booth, and thank you so much for your attention.